Here we came to the last region of the lower limb, which is the foot. So the functions of the foot is very important because it plays a double role so it acts as a rigid support for the weight of the body in the standing position and as a mobile springboard during walking and running. So it supports the body in standing and act as a mobile springboard during walking and running. So this is the surface anatomy of the foot. As you can see here, this is the medial malleolus and this is the lateral malleolus. Here this is the big toe, the fifth toe, and as you see, this is the tendons, extensor tendon. This is the extensor digitorum longus tendon, and this is the extensor hallucis longus tendon. And this we can see the tendon of the tibialis anterior muscle. Here is the side of the dorsalis pedis pulsation when we pulsate for the peripheral pulses. And this is the medial longitudinal arch of the foot. Again, this is the malleolus. This is the extensor hallucis longus tendon. This is the extensor digitorum tendon. And all the superficial veins here. You can see this origin of the small saphenous vein, and here this is the greater saphenous vein. So let's talk about the osteology of the foot. As we mentioned, the foot is formed by the tarsal bone, metatarsal bone, and the phalanx. The tarsal bone including the talus, which is the ankle bone, the calcaneus, which is the heel bone, cuboid, navicular, medial cuneiform, intermediate cuneiform, and lateral cuneiform. And then the metatarsals. This is the first, and this is the fifth metatarsal. The phalanx, proximal and distal phalanx, and proximal and distal, and this is the medial phalanx. The arches of the foot include the medial longitudinal arch, lateral longitudinal arch, and transverse metatarsal arch. So these three arches of the foot. The medial longitudinal arch is composed of calcaneus, talus, navicular, and three cuneiform, and the three metatarsal. The talar head is the keystone of the medial longitudinal arch. The tibialis anterior help in strengthening the medial longitudinal arch. Also is some assistant of the flexor hallucis longus, also supports the medial longitudinal arch. The lateral longitudinal arch is much flatter than the medial part of the arch and rests on the ground during standing. It is made up by calcaneus, cuboid, and lateral two metatarsals. The transverse arch of the foot runs from side to side. It is formed by cuboid, cuneiform, and the base of the metatarsal. Again, you can see here these arches. Okay, this is the lateral formed by calcaneus and navicular bone, and here we have the metatarsal. And the transverse metatarsal arch is formed by the three cuneiform, navicular, plus the base of the metatarsal bone. So the arches are maintained by the shape of this interlocking bone, the muscle action, the ligaments of the foot. This ligament include the plantar aponeurosis, the long plantar ligament, the plantar calcaneocuboidal ligament, and the plantar calcaneonavicular ligament, which is known as spring ligament. The weight-bearing area of the foot, as shown here, this is for the calcaneal tuberosity, and here this is for the sesamoid bone of the first and the head of the second metatarsal. So this area, big area here, is for weight bearing of the second head metatarsal and the sesamoid bone of the first metatarsal, and then this is the third, the remaining here for the third, fourth and fifth metatarsal bone heads. The dorsum of the foot, as you see, there is the skin and the subcutaneous tissues. We had the veins, superficial veins. This includes the dorsal venous arch here, and the beginning of the greater saphenous vein and the small saphenous vein. You should look at how does this vein goes in front of the medial malleolus, and the lesser go behind the lateral malleolus. Muscles of the dorsum of the foot. Here there is two muscles, the extensor digitorum brevis and the extensor hallucis brevis. The extensor digitorum brevis, as you can see, the tendons runs here to the middle three toes, but not the fifth and not the big toe. The extensor hallucis brevis is running here to the big toe. So these two muscles found it in the dorsum of the foot. You can see it now here. This is the extensor hallucis brevis, one muscle, one tendon, and this is the extensor digitorum brevis tendon here. As you see, the other tendon is for extensor digitorum longus. So each one of these two having two tendons, one for digitorum brevis, one for digitorum longus, brevis, longus, brevis and longus. But here the little toe only have tendon from the extensor digitorum longus, but not brevis. So dorsalis pedis artery, as it's very important artery that can be palpated in the dorsum of the foot. It's very important in clinical examination to detect if there is any vascular injury to the limb. So it's one of the peripheral pulses that usually detect at hospital. It's a continuation of the anterior tibial artery. The branches are the medial and lateral tarsal branch, and also arcuate arch, and first dorsal metatarsal artery and deep plantar artery. So as we can see here, this is the anterior tibial artery, then here change into dorsalis pedis, and here giving this perforatings arteries and the lateral medial tarsal arteries, and here giving the arcuate artery. The arcuate artery is here as the base of the metatarsal bone, is a branch from the dorsalis pedis. It's also give the first dorsal metatarsal, and here the deep plantar arteries. These are the deep plantar artery here. So these deep plantar artery are very important because they are forming the deep plantar arch together with the lateral plantar arteries. So the pulsation of the dorsalis pedis should be done with the foot at a neutral position. It sometimes need to be a little bit plantiflexed and here we can check the pulse between the two tendons of the extensor hallucis longus and the tendon of tibialis here, anterior. Regarding the innervation of the foot, of the dorsum of the foot, most of the dorsum of the foot is innervated by superficial peroneal nerve or superficial fibular nerve, except the web space here between the first and second toe, which innervated by the deep fibular nerve. The area over here is innervated by the saphenous nerve, which branch from the femoral, and here laterally is innervated by the sural nerve. So we're done with the dorsum of the foot. Let's move to the more difficult part, which is the sole of the foot. So the sole of the foot, after removing of the skin, we can see first this pyramidal or triangular fascia, which is the plantar aponeurosis, came from the toes and attached it here to the tuberosity of the calcaneum. So this is the plantar aponeurosis, and you can see here this is the fascia, medial plantar fascia, lateral plantar fascia, and this is the medial plantar fascia. So let's talk about the layer. As we know, there is 4 layers in the plantar aspect of the foot. The first layer containing 3 muscles. These muscles are the abductor hallucis. Hallucis means the big toe, so abductor hallucis here, and abductor digiti minimi for the little toe. And here this is the flexor digitorum brevis, flexor digitorum brevis. So this is the first layer of the foot containing 3 muscles. If we go to the second layer, here there is 2 muscles and 2 tendons. Okay. The 2 muscles and 2 tendons is here. The 2 tendons, we have the first tendon, this tendon, the flexor hallucis longus tendon, and the others is the flexor digitorum longus tendon. Both of them are tendon of muscles of the posterior compartment of the leg, as we mentioned before, the flexor digitorum longus and flexor hallucis longus. The 2 muscles of the second layer are the lumbaricals, as you see here, which emerge from the tendon of the flexor digitorum longus. These are the lumbaricals. We had 4 lumbrical muscles, and this one here is the quadratus plantae muscle. Also, this is the second muscle of the foot. When we move to the third layer of the foot, it contains 3 muscles like the first layer. So 3 muscles is forming the third layer. The first muscle, which is flexors hallucis brevis, running here toward the big toe, and the flexor digiti minimi. And the third muscle is the adductor hallucis. Okay, it's adducting the big toe, so it's adductor hallucis. Also here it has 2 heads, so oblique head and the transverse head. It has 2 heads, transverse head and oblique head. So the third layer of the foot containing 3 muscles. Again, let's see them. the flexor hallucis brevis, the flexor digiti minimi brevis, and the adductor brevis. Adductor, it has oblique and transverse head. Above the fourth layer of the foot, it also containing two tendons and two muscles, like the second layer of the foot. Two tendons and two muscles. The two tendons include the tendon of peroneus longus, and the second is the tendon of tibialis posterior. The one running from lateral to the medial is the tendon of the peroneus longus here, attached at the base of the first and medial cuneiform. And this one here is the tendon of the tibialis posterior muscle. The muscles are the dorsal and plantar interossei muscle. As this muscle shown here, this is the plantar interossei. If we see them from the dorsum, this will be the dorsal interossei muscles. So two muscles is found in the fourth layer of the foot. So the innervation of the foot is by medial plantar nerve and the lateral plantar nerve. We should remember the mnemonics, the LAF. L for lumbricus, first. A for abductor hallucis. F for flexor digitorum brevis, and the second A for flexor hallucis brevis. So these four muscles are innervated by the medial plantar nerve. As you can see, most of them running in the medial aspect of the foot. The lateral plantar nerve supply all others plantar muscle. The deep fibular nerve supplying the extensor hallucis brevis and extensor digitorum brevis. So this is the nerve for the dorsum of the foot. The two muscles found in the dorsum of the foot are innervated by the deep peroneal nerve. But all of the muscle of the sole of the foot here, or the plantar surface of the foot, innervated by medial and lateral plantar nerve. The medial for the first lumbrical, abductor hallucis, flexor digitorum, and flexor hallucis brevis. All the other muscles are by the lateral plantar nerve. So you should remember this LAF. So the movement, as you can see here, this is flexion of the toes, and this is extension of the toes. Here, this is the abduction, moving away from the second toe, and this is abduction. This is a relaxed position, so when the toes are abducted. The vessels of the foot. As we mentioned, the anterior tibial artery will continue as dorsalis pedis. Here you can see the pulsation between the extensor hallucis longus and extensor digitorum, easily pulsated here. And arcuate arteries and other branches from the dorsalis pedis, one of the branches of the dorsalis pedis. Regarding the sole of the foot, we have the posterior tibial artery, which give medial and lateral plantar artery. And here we have also the deep plantar arch is formed here. So this is the posterior tibial artery. It's giving the lateral plantar arch and the lateral plantar artery and the medial plantar artery. As you can see, the lateral plantar artery runs here and give this perforating arteries and give also the deep plantar arch. Okay, this is the deep plantar arch, and here give arteries to the metatarsal, plantar metatarsals arteries, and then this plantar metatarsal will give these branches to the toe, which we call it digital branch. These are the digital branch. Remember, this digital branch run as the lateral aspect of the toes, so you should not injure them during injection of local anesthesia or any other procedures that you performed. Remember, this artery is running at two sides of each toe. The nerves you mentioned, the medial and lateral plantar nerve and the cutaneous and motor supply to the muscles. Again, this is to review the cutaneous supply. Here this is the superficial, and here this space, small sweep space here is by the deep fibular nerve. This is the saphenous nerve, this is the sural nerve. And the sole, here we have the tibial nerve supplying area over the heel, and here is the medial plantar and this is the lateral plantar, saphenous, and here sural laterally. Don't forget the dermatomes. As you see the dorsum of the foot here, we had the most lateral S1, L5 from the big toe to the fourth toes from L5, and so any numbness here can help to detect if there is an abnormalities in the level spinal segment L5, which is common with people presenting with lumbar disc prolapse, as it's common to have disc at this level. L4, and here this is S2 at the medial sole and S1 at the lateral sole. Between we have L5. So let's see some clinical importance of such things. Here we have the flat feet or the flat foot, the pes planus or planus valgus, low or no arch. This is how does it look like? Flat foot, there is no arches here, or absent arch or low arch. So this is the flat foot. This is the imprint of the normal foot, and this is the print of the flat foot. Clearly difference, and even the distribution of the weight bearing area differ between the normal and the flat foot person. Sometimes we can find high arch foot, as we see in such the photos, which we call it pes cavus or planus valgus. Planus valgus. A common abnormalities we can see it is the hallux valgus. When the big toe move laterally, the hallux valgus, so it deviated laterally. It's very common, especially in females. Could be related to wearing narrow shoes or sometimes hereditary. The hammer toe, here the proximal dorsiflex is dorsiflexed, the middle phalanx is plan, and the distal phalanx dorsiflexed. So this the appearance of hammer toe. It's also due to tendons getting short, the flexor tendon shortening or cutting in the extensor tendon. The plantar fasciitis, which is very common, it's inflammation over soft tissue and beneath the calcaneum, causing severe pain, especially early morning when walking. Sometimes it could be associated with this calcaneal spur. Club foot also when the foot is inverted or twisted medially and inverted and flexed, so we call it the club foot or Talipes equina varus. So thank you so much for your attention.